Here are the learning objectives for CBT 1. First, patient safety, the 5 rights of medication administration, safety warnings, efficiency, and bedside resources. In 1999, the Institute of Medicine reported that at least 44,000 and perhaps as many as 98,000 Americans are harmed or die in hospitals each year as a result of medical errors. It is estimated that 2% of all hospital admissions experience some kind of adverse medication event. Redlands Community Hospital has responded to this challenge by proactively working toward the safe administration of medications by implementing EMAR, the Electronic Medication Record, and BMV, which is the Bedside Medication Verification System. It arrives in fall 2010. EMAR and BMV support our safety culture by involving the patient in his care and visibly demonstrating our safe practices. The following will explain the process. EMAR uses the same barcoding technology that speeds up grocery store checkout lines and makes sure the cashier doesn't charge too much for something like a carton of milk. EMAR and barcoding uses barcodes on medications and patients' armbands to reduce the possibility that a patient might be injured by medication error. EMAR and barcoding offers opportunities to look for potential errors you may not realize exist. Watch how EMAR and barcoding supports the nurse giving meds while at the bedside. When it's time to administer the medication, the nurse uses a computer, a barcode scanner, and a barcode-labeled medication packaged by the pharmacy. The nurse then scans both the medication barcode and the patient's armband barcode. The computer checks and confirms that this is the right patient, the right medication, the right route, and the right dose, and given at the right time. It also uses safety warnings to alert the nurse if conditions exist that should be checked. The nurse then gives the medication to the patient. The nurse then leaves the room knowing that the patient has received the safest possible care. EMAR and barcoding makes the patient feel at ease about the safety of their care. In January 2010, the nursing department participated in a medication cart fair. They were asked to assess several medication carts which would best serve their clinical needs. Nearly 100 nurses judged the design, features, and maneuverability of the carts and selected the Innovate workstation as their choice. The lightweight cart will bring bedside medication administration and computerized documentation directly to the patient bedside. On a daily basis, nurses are faced with difficult decisions and need resources at their fingertips. The new Innovate cart allows the nurse to have their own workstation and to access the patient's electronic record with ease in order to document. The cart will allow access to references and resources such as Citrus, UpToDate, Mosby's, and Policy and Procedures. It can also be used as a visual tool for patient and family education. The cart will also help to provide pertinent information to the physician while doing rounds and administering patient medications. From top to bottom, we will review the features of the Innovate workstation. All contact surfaces are made with antimicrobial silver, which provides resistance to germs and bacteria for effective infection control. The lightweight cart can be adjusted to the proper height by a manual spring lift and adjusts via the height adjustment lever. The monitor has a full 360-degree swivelability, which makes it possible to be fully rotated to be viewed by the patient, family, or physician while sharing information or during patient education. The work area also doubles as a storage area. The dashboard shown here is where you'll find the on and off power button. Also, you'll see the battery use indicator and a keyboard light, which is provided for better night visibility. Access to the medication compartment is password dependent via the number keypad and is located on the right side. This code will be department specific. This cart incorporates a mouse holder and also has a mouse tray which is usable on either the left or the right side. This cart also has a wireless scanner with a charging holder. It is important to remember that our battery-powered carts will require recharging. This process will be standardized throughout all departments every 6 hours, and they must be recharged for at least 1 hour. At Redlands Hospital, EMAR and BMV will create patient safety, pharmacy efficiency, nurse satisfaction, and patient satisfaction. All in all, knowing that medications are administered in the right dose at the right time to the correct patient is integral to ensuring medication safety, and it supports our culture for patient safety. It is a win-win-win for patient satisfaction.